My husband and I were getting ready to take a trip to Florida. I was running up and down the stairs doing laundry, and I passed out. I didn't have any of the typical risk factors. PE was kind of the last thing.
When these chronic blood clots go untreated, it can cause a lot of suffering. And it's unfortunately a very significant and gradual decline. I
started to do less and less. My world was getting progressively smaller because of the shortness of breath and the fatigue. I'm starting to think that maybe I'm not going to, live longer than 5 years. We were at home. I stood up and I passed out, rushed to the hospital, and I had had my 4th PE. They had done the echo and they saw damage to the right side of my heart. And it was at that point that they diagnosed me with Cteph. And they said, you need to see the folks over at Temple.
Cteph stands for chronic thromboembolic pulmonary hypertension. This is a condition of high blood pressure in the lungs after a person has had a pulmonary embolism. You're left with obstruction in the pulmonary vascular bed and then ultimately can lead to a condition of right-sided heart failure.
Prior thinking was that the chances of developing Cteph was potentially up to about 5% after having an acute pulmonary embolism. It's likely been very underestimated, and it's not nearly as rare as what had previously been thought. If a patient is not treated for Cteph, it absolutely can be life-threatening.
Typically, the only thing that can be offered is medical therapy. And what we often see in those patients is that they never improved.
There are no other ways to treat Cteph unless it's assessed by an expert multidisciplinary team. We offer the whole host of treatment options, including pulmonary thromboendarterectomy, or PTE surgery, balloon pulmonary angioplasty, or BPA, and we offer medical therapy.
About 2/3 of patients with Cteph have clots in a particular location, quantity, and type that is amenable to the PTE surgery.
I had a pulmonary thromboendarterectomy.
This is open chest surgery in the operating room. It takes a great deal of technical expertise. Our surgical team is able to retrieve chronic blood clots not just from the main arteries of the lungs, but all the way out to the distal edges of the lungs as well.
For many or most of our patients, they have complete resolution of their pulmonary hypertension and a complete reversal of their right-sided heart dysfunction and their right-sided heart failure. And that's what we call a cure.
Dr. Forfia and Dr. Vaidya called, and knowing the quality and the kind of program that they were developing here, I didn't have to think very hard. Temple's pronounced role in this community is only growing, not only within the United States, but internationally. Pulmonary Hypertension Association, or PHA, established a set of criteria where folks who care for patients with pulmonary hypertension could apply. It turned out to be pretty much a slam dunk for this group simply because of the high quality care that they provide to patients with pulmonary hypertension, and we are now an accredited organization by the PHA. The growth of Temple's Cteph program has been extraordinary.
We are one of the only programs to have this many physicians that are full-time dedicated to this disease state.
At Temple, we are now the second largest endarterectomy program in the United States.
To date, performed over 200 PTE surgeries. We are on pace to do 80 or 90 just in this year.
Our outcomes hold up to world standards in terms of what the expected survival and degree of improvement is after PTE.
We have a good life now. My mom telling me that she knows that I'm better because I look better, and she knows she can tell that I feel better. This is one of the only places in the world that does it, and they do it so well, and they have so much experience.
Education is paramount in order to get the message out, and the importance of that is because it's so curable. Temple is part of that education mission to improve physician recognition, diagnostician recognition. We are going to move it forward over the years ahead.